Hello there. My name is Pharmacist Michael, and today I'm going to talk about natural ways to treat autism, including nutritional supplements. April is World Autism Awareness Month, a time when we shine a light on autism, which affects 1 in 36 kids today. With so many families touched by autism, there's a lot of buzz around different treatments and supplements that might help. It's crucial for these families to receive correct information on the supplements that can be helpful for autism and those that may be ineffective or even harmful. So, I'm going to cover some of the most popular supplements currently used to treat autism. Stay tuned. You don't want to miss this one.
Welcome to Pharmacist Michael's Happy Healthy Living channel, where you will learn how to improve your life, one video at a time.
First, let's talk about the natural things that we're pretty sure can help with autism. The first isn't a supplement, it's music therapy. Music therapy is like a special kind of magic for kids with Autism Spectrum Disorder, or ASD. It's not just about having fun with music. It's a serious way to help these kids communicate without words, improve their attention and memory, and feel more comfortable around others. Imagine music as a bridge helping kids with ASD connect with the world around them in ways they hadn't been able to before. In a study done in 2018, some kids aged 6 to 12 tried out music therapy, and the results were pretty awesome. These kids found joy and fulfillment in doing things they hadn't enjoyed before. It's like music gave them a superpower to feel more confident and share that happiness with others. But how does it work? Well, for kids with ASD, their brains are often on a bit of an overdrive, making it hard for them to control their actions or learn new things. Music therapy has this cool ability to calm those overactive parts of the brain, particularly in areas that deal with learning, memory, and being aware of what's going on around them. This means kids could do everyday tasks better, like walking or holding a cup, and even communicate more effectively. Besides the brainy stuff, music therapy also made a big difference in how these kids behaved. They got better at talking with others and connecting with their families, and some of the tough behaviors that often come with ASD started to ease up. So what's the takeaway? Music therapy isn't just playing songs. It's a thoughtful approach that needs the right music and the right people guiding the process. When done right, it can really help kids with ASD feel more at ease, communicate better, and enjoy a better quality of life. It's not a cure-all, but it's a powerful tool that can make a big difference, showing us that sometimes where words fail, music really does speak. An 8-year-old boy with autism, who had difficulty communicating and showed hyperactive behavior, experienced a big change thanks to a trial at Hafiz Hospital in Iran back in 2011. Despite trying medications like risperidone and theoridazine without seeing much improvement in his behavior, something new was tried, a supplement called N-Ac, or N-Acetylcysteine, given at 800 milligrams daily. Surprisingly, not only did the boy's nail-biting habit get better, but his parents also noticed a big improvement in his autism symptoms within just 30 days of starting NAC. He started interacting more, his verbal skills got better, and his aggressive behaviors calmed down significantly. He even started showing interest in different toys, something he hadn't done before. The only downside reported was a mild abdominal pain, but that was it. This is interesting because NAC is known for its antioxidant effects, which can help with various psychiatric disorders. Autism is complex and not fully understood, but it's thought that oxidative stress plays a big role in its challenges. NAC seems to help by tackling oxidative stress and possibly reducing inflammation in the brain, which could be why the boy showed so much improvement. But it's important to note that this was just one case without a control group, and more research is needed to see if NAC could help other kids with autism too. As a side note, I once worked with a child psychiatrist who prescribed NAC to most of her patients. She was convinced that this supplement had many benefits for her pediatric patients. There's some proof that melatonin can help kids with autism sleep better and fall asleep faster, but it's not so clear if it helps with their behavior. Studies haven't really looked into that specifically. Melatonin is generally safe for short-term use, with doses up to 12 milligrams daily. But for regular use, it's recommended to keep it to 3 milligrams daily for little ones over 6 months and 5 milligrams for teenagers. I always recommend lower doses to minimize side effects. It's also super important to keep melatonin, especially the gummy kind, away from young children. They might think it's candy, leading to kids accidentally taking too much. I will say that I recommend you talk to a doctor before giving melatonin to any child. Then there's vitamin D. Some studies suggest that not getting enough vitamin D during pregnancy might increase the chance of a child being diagnosed with autism, particularly if the vitamin D levels are very low. But giving vitamin D to kids who already have autism doesn't seem to have clear benefits for their symptoms. Still, taking vitamin D within the recommended limits is generally safe, and I always recommend getting vitamin D levels checked yearly, especially if you live in the Northern Hemisphere. A worrying trend is turpentine oil. This got popular in 2019 when some celebrities and online influencers started saying that autism is caused by parasites and that turpentine oil could cure it. As I have mentioned in other videos, be very wary of supplements being promoted by celebrities. Also, if it sounds crazy, do some research. It's really important for families to understand that autism is a neurological condition kids are born with, not something caused by parasites. And eating or drinking turpentine oil is dangerous. Despite what any blog or podcast might suggest, it's not a safe treatment for anything. Understanding what's out there can help families navigate the sea of information about autism and find safe ways to support their loved ones. Stick with music therapy and give N-Acetylcysteine a try if your child has autism, and always feel free to reach out to me if you have any questions or comments. If you would like more information on happy, healthy living, nutritional supplements, or medications, be sure to subscribe to this channel. We release 3 new videos each week. My name is Pharmacist Michael. Be happy and be healthy.